Hi there, Misty here. Just thought I would pop in and do a little update. I'm still on pause with chemo. The respirologist got a hold of me yesterday and we reviewed the results from my Broncioscope. The fungus culture takes about 8 weeks, so they didn't get the results back from that yet. But the preliminary shows that it's all clear. And all the other tests didn't show anything of concern. When the respirologist was looking around in there with the camera and from the other, like the CT scan and stuff, she said she didn't see any sign of emphysema, which is good. They also did the alpha-1 antitrypsin blood test, and that actually came back as high for higher than normal range, just a little bit, but it is flagged high. And so I had done some reading on that. I had looked at some of my results before she phoned me. I looked it up and it said if there's an infection, a lung infection, or inflammation, it can spike the alpha-1 antitrypsin to show a higher amount than normal. So there's a possibility that that reading isn't even accurate, because I just had a lung infection that I had just gotten over medication for not long before that, and there was possibility of inflammation in there. Some of my other blood work when I was at the local hospital showed lots of markers for inflammation, although the markers don't specify where the inflammation is. It just shows that there is inflammation of some sort. So anyways, I talked to the respirologist about that, and she said, yes, that is the case. And when I'm not sick, maybe down the road, I could talk to my family doctor about getting retested. It's just a blood test, so it's not a hard test to have done. I guess with all of that, I guess I'm left with more questions than I had before having all this done, because if there's no emphysema, and if the alpha-1 antitrypsin is normal, not a deficiency, then I guess why have I had breathing problems my whole life? I remember back in elementary school, oh man, I just dreaded gym class because we would have to do laps, and even trying to get one lap done just about did me in. I've never had good lungs, and they've just progressively gotten worse over the years, and I do try to stay active. I purposely I haven't since doing all this treatment because I'm just not up for it, but normally I purposely try to get my exercise in. I walk the property, or I do lots of chores, or I do lots of things, and we have a hill on our acreage, and I regularly make sure that I go up the hill so that it's not a steep mountain or anything like that, but it's a hill, and I do have to take breaks coming up it because I get huffing and puffing, but I regularly try to do it just to keep my lungs at least a little bit exercised. So I don't know, I guess I don't quite understand why my lungs would be having the difficulties that they do have if there's no reason for it. So I'm not sure. I'll have to follow up with a doctor with that later on, I guess. So then at the end of the call, I asked the respirologist if the report had been sent to the oncologist, and she said because they're in different health regions, if it got bounced back, there's no way of the respirologist to know that the oncologist didn't receive it. But the respirologist would send a report of that day with the discussion that she had with me to the oncologist, and she should receive that. And that was all on yesterday. So I kind of thought I might get a phone call today, either yesterday or perhaps today, from the oncologist, and I haven't. So I have no idea if she's even received the report. I have no idea how to get a hold of the oncologist. All contact with her has been her contacting me. And when I get a number, it usually says private number, so I don't know how to get a hold of her. I was thinking if I don't... Oh, jeepers. I was just thinking about something. Our GPOs don't work in the clinic on Fridays, and I just thought of that right now because I was thinking maybe if I don't hear from them tomorrow, hear from my oncologist first thing in the morning tomorrow, I would get a hold of my local GPO and they could send her an email saying that there's results, just maybe so that she's aware of it. And if she didn't get it, then we all know to try and actually get her the results. Then after we discussed that, the respirologist said that she has heard before of people having breathing problems from the first 2 chemo medications I'm on, even though it's not a typical side effect from it. My oncologist said it's not a typical side effect. I guess it could be an occasional or rare side effect. So the respirologist basically said that I would need to have the discussion with the oncologist to weigh the pros and cons of whether to continue the chemo. Taking the chance of my lungs getting affected again, opposed to the chance of not doing more chemo and possibly increasing the risk of my cancer coming back. So I don't know what to think of that. Neither one of them seems like really fantastic options, but in all honesty, this whole journey, nothing sounds like awesome options. It's just make the best of it and hope to get it over and done with so that I can get feeling better after. And I guess I'm still trying to take that thought process. So I don't know. I guess I'm just waiting and trying to figure out how to have contact with the oncologist to see what she says. If I'm going to continue the chemo, I'd like to get these discussions going so that I can possibly get my next treatment set up for next week. If they're every 2 weeks and I say I do my treatment on Wednesday, there's actually 3 Wednesdays in September. I could officially be done my chemo by the end of September. And that sounds excellent to me to be over and done at. Of course, that'll be getting the treatment that day, and I still will be recovering from getting the treatment, but that's okay. I'll be over and done with, and hopefully, fingers crossed, never have to worry about anything like that again. But anyways, that is a quick update on the respirologist, and really learning nothing is basically what it comes down to. Yeah, so anyways, thanks for checking in, and I hope everybody has a good evening or a good day, whatever time it is that you're watching this, and we will be in touch. Chat soon. Take care, everybody.